We are gonna get into introductions, but first I want to offer you this land acknowledgement. So the BC Health Coalition, the physical office is on Main Street, and that's located on the unceded and occupied territories of the Coast Salish people, specifically the Musqueam, the Squamish, and the Tsleil-Waututh nations. I myself am calling in from Port Moody, which also includes the unceded lands of the Stolo and the Coquitlam nations, as well as the Coast Salish. And I just want to offer that unceded means that this land was never surrendered, relinquished, or handed over in any way to the Crown. And the BC Health Coalition is in an ongoing and active effort to decolonize our own work practices, build relationships, and invite First Nations people to our decision-making table. I'd invite that if you're interested in finding the specific territory and nations in which you live, I'll share a quick link in the chat box so that you can search your own. So my name is Edith McCaddy. I'm the co-chair of the BC Health Coalition, and I'm wondering if Kathleen has been able to log on. Kathleen, are you here? Just checking if you're not on mute. Okay, so Kathleen will certainly be joining us in a moment or two, and Kathleen is our community co-chair, the co-chair of the Health Coalition as well, and she is representing Costco. So I am very pleased to, again, welcome you all. Thank you for joining us. This is the first virtual AGM that we've held, so thank you in advance for your patience as we figure this all out. And I think we're pretty excited at the idea that this can actually increase some access to our process. So welcome. You have been sent an agenda already in your package that included the minutes from our previous AGM. It included a financial statement and as well as bios and our annual report. The lunch and learn session that will start very shortly, and discussion, as well as the annual report and the financial statement presentation, is certainly welcome to the general public, to BC Health Coalition members. We will move into a caucus process after that, where the Labor Caucus organizational reps and the community organizational reps will break out into two small groups, and that process is not open to the general membership, and the organizations will enter into a decision-making process to figure out who will be on the steering committee for the following year. We have a number of steering committee reps on the call right now, which is wonderful, and I just deeply thank them for all of their work this past year. In the annual report, there's a full list of all of the current members on our steering committee. I also just wanted to quickly name, before I hand it over to Audrey, one of our staff people who will go through sort of some of the technical details of this AGM. I just wanted to name that this has been an extremely intense year for most people. We're in the midst of the COVID-19 health pandemic and also a very serious opioid crisis. And I just really wanted to name that our hearts are going out to and really standing with everyone who has lost loved ones to both of these public health crises. And we're just like so proud of the work that this health coalition has done in the past year. And it's just really underlined, like every day, I'm just so grateful for our public health care system. So I'll turn it over to Audrey at this time. Audrey is one of our new staff, and she'll go through some of the housekeeping notes. Thank you, Audrey.
Thanks, Edith. Good afternoon, everyone. I'm Audrey. As Edith says, I'm quite new to the staff team at BCHC. I'm the new organizer, and I'll be taking care of the technical hosting side of today's meeting. So if you have any issues, please send me a direct message in the chat. I want to let everyone know that we'll be recording the public section of this meeting. So both the speakers, the Q&A, and the financial report and annual report overview. We won't be recording the caucus section of the meeting, so that you can just feel free to deliberate. A few things to note as we're going over Zoom housekeeping is it would be very helpful for us in preparing the breakout caucuses if members of organizations could rename themselves to include your organization. You can do that by hovering your clicker over your own video, and then there'll be a little blue square with 3 dots that pops up. If you click on that, it'll say you'll have the option to rename, I believe. And so if you can just kind of dash and then the name of your organization after your name, that will help us make sure that you end up in the right caucus. And if that is a little bit too technically challenging, you can feel free to put it in the chat, just, hi, my name is Audrey and I'm from the BC Health Coalition. That way I'll know which organization caucus to put you in. And if you're an individual member, welcome. You don't have to worry about that, but we're very glad that you're here. We will be monitoring the chat, so if you have questions or comments, the staff will try to be paying attention to that. Ida said this already, but a reminder to keep yourself muted if you're not speaking. And mostly the speaking portion will be during the caucuses or during the Q&A. So we'll let you know when it's time to unmute and jump in. I believe that the documents will be posted in the chat. So all the ones that were sent by email will be kind of linked and available for you there. And I think that is all in the housekeeping side. So I'm going to hand it over again to our chairs. I'm not sure if Kathleen has joined yet. Kathleen, are you here?
I have a question to ask.
Yes, it's on.
Okay, you explained in the beginning what you were saying about the names and putting on the either side, so what was the icon you were using?
On your own video, there's if you put your clicker over it and hover, there's a little square with 3 dots.
Square with 3 dots? Yeah, I have 4 dots, 1, 2, 3, 4.
It's on, I can help you do this from my end.
Sure.
Just send me a message in the chat.
Sure.
I think Kathleen is here, actually. Kathleen, are you here?
Yes, here I am.
Welcome.
Thank you. It was a little bit of a struggle. I'm not sure why. I didn't seem to have the connection. And then one of my laptops is playing up. I got another. So nice to see you.
Kathleen, this is a time when everyone just has to have a lot of grace and patience with each other and technology.
Yes, I hope so.
So I've done some sort of opening remarks and introduction. Are you able to introduce our speakers?
Absolutely. Yeah.
Great.
Okay. So I'm very happy to be able to do so. I just want to say something very quickly because we have a very tight agenda about the issue. So, which is a major and increasing concern of many people in BC, the opioid crisis. And I'm hoping, and I believe that advocacy and action on opioid mental health issues and homelessness will be part of an upcoming BC Health Coalition strategic planning session. In the meantime, we have an opportunity today to hear from 3 experts on the issues, Dave Hamm, Samona Marsh, and Jonathan Morris, who will each speak for 10 minutes. I will introduce Dave Hamm first. Dave Hamm is a peer facilitator with Pivot Legal Society, works on community education as part of Project Inclusion. He's a member of VANDU, and has served as both a board member and president. Dave has a long-standing relationship to the downtown east side, as his grandfather used to operate a jewelry store at Pigeon Park in the 1950s. With his late partner, Charisi Kiwatin, Dave spearheaded the original downtown east side street market in response to the bylaw ticketing of street vendors. He is honored to serve his community and continues to memorialize the work that Charisi, a fierce and dedicated activist, whose legacy should never be forgotten. R.I.P. Charisi. So Dave Hamm, take it away. You've got 10 minutes. Thank you.
Great. Thank you very much for that.
Unmute the mic.
Thank you very much for that introduction. Well, Minashi did a real nice job with that bio. I'm quite impressed with that, especially mentioning my partner, my past partner here. She was a big driving force in a lot of things down here, which goes to speak of her about mental health and things like that. When people have a chance to maybe step out of themselves, sometimes that is a way to help themselves in a way by helping others. It seems to be a theme that goes through the community when I see people learning how to stand up for themselves, maybe speak for themselves, have a voice finally. So things like that, if we can keep encouraging and being there all the time, to make sure that their voice is heard, like that they're a sounding board, if nothing else, besides that, because that will keep people involved. Otherwise, in these times, it's pretty hard to connect a lot of the time the way we used to. And sometimes I think that those kinds of mentoringship kind of things and all that maybe are hurting quite a bit. So, and I was also going to speak about how different programs that Bandhu's been involved with have helped out the community, especially the opioid using people. A lot of the time there was like a lot of distress and disease in when you're not feeling well from a withdrawal, and people, they're wanting to maybe make a change, but this relentless physical afflictions make it very hard, right? Make it very disconcerting. So we found that with the marijuana replacement program that was put in place with the help of Neil, I can't remember his last name at the moment, but we ended up helping a lot of folks for like over 2-3 years, twice a day or twice a week. We would give out marijuana products, CBDs and THC items. Speaking to the CBD part of it, I find that I actually had people personally tell me that they had more or less gotten off their opiate addiction by using these, using these products, the edibles and different things like that, that just helped them with the physical easing of those symptoms and things like that, which allowed them, a little greater latitude to get doing other things and all that. And so it came to the point where they weren't using as much anymore at the opiate thing. Maybe they ended up getting on a good program that finally worked for them, with the replacement issue and all that. But all that is a huge step forward in a person's mental health, I would say. You know what I mean? You're getting to that point, then you can be active a little more in your community and available and all that too, right? Plus to just be there and take part. The other part, what was I going to think about? Oh yeah, it was a very kind of I would say revolutionary type of using acupuncture, which was brought in by a gentleman. I wish I had some information with me. I'm so sorry, I wasn't quite prepared enough for this when it comes to that information, but he was using copper and silver to initiate the different points, the acupuncture points on hands and feet, which was to cause an overall general feeling of ease, like to create the chi flowing properly, any blockages. It was like a kind of like a taking doing one thing that was just can generally make your whole system work better, your whole chi flow properly, no blockages and all that, which in itself would cause a sense of ease. Like all of a sudden I realized personally when it happened that I would feel within moments, all of a sudden this kind of idea that I wasn't feeling something that I felt all the time. And it's like that constant pain that's there that you don't acknowledge, because if you acknowledge it, then it'll become something, right? So it's just there. It's just something that you deal with and you live with, and it's there. Where all of a sudden, because of his treatment, all of a sudden you felt this almost like your shoulders relax and things happening, right? In that you were feeling more at ease with yourself, right? So I'm just saying there's things out there in your community that can that are along these lines, or if there's any way to get do that, I would suggest that that's something people look into. Anyways, it's as we said before, it's just another tool in the bag, right, to help us get through this opiate tragedy that's been happening. I don't know if that's 10 minutes, but
Yes, that's about very well timed. Thank you, Dave. I think
Okay.
we'll be hearing a lot more from you, I hope, in the future. Samona, I have a short bio here for you. Samona Marsh is a peer facilitator with Pivot Legal Society, working on community education as part of Project Inclusion. She's currently the president of Vandu and also serves as a board member of the BC Yukon Association of Drug War Survivors, Brave Technology Co-op, Canadian Association of People Who Use Drugs, Crackdown Podcast Editorial Board, and the Sex Workers United Against Violence. Samona has co-authored several recent articles, including activism and scientific research, has 20 years of community action by the Vancouver Area Network of Drug Users, and is building new approaches to risk reduction with social networking and people who smoke illegal drugs from participatory community-based research. So there's a bit more here, but in the interest of time, I will let Samona just tell us herself now what she does. We do need guidance from you and from Dave. Go ahead.
Hi, I'm Samona. Oh my God, I'm lost. With Research 101, we're researching. Oh, I'm Samona. I'm the president of Vandu and the treasurer of BC Clan for Drug War Survivors, plus many other hats.
Yes.
Why do I do it? I do it because I'm a drug user, and I have been for 90% of my life. And I think that if the people that make decisions took their head out of their ass, excuse my puns, and admitted that they did drugs, then we wouldn't be having such a bad opioid crisis that we're having. Last month, I lost my mom to a fentanyl overdose. So it's like really hits home large. Like I lost my dad in 2015. So I think that, once they make drugs legal and there's less hype about people who use drugs, then there'd be less stress, less people dying, because more people would be able to walk into a overdose prevention site and not be like, oh my God, who's going to see me walk in here, right? And what are they going to say? Because it shouldn't matter. Like people that drink, everyone's out saying, oh, how many drinks do you have a day? Like they don't care, right? Because it's legal. But because drugs are illegal, it's like, oh, you know what she does? It's like, who cares, right? Yeah. Like we're all human. We all have an addiction to something. Doesn't matter what it is,
And everybody has a safe supply of their what their choice is. But
yeah.
Why do drug users? Because it's been made illegal, right?
That's right. That's why I'm an ethical substance use navigator as well, which means I'm a glorified drug dealer. Whenever there's a conference that goes on and people that come into town, instead of them going to Maine and Hastings to get their dope, they phone me and I make sure that they get exactly what they want and nobody's dying. So the government may say that's legal and so be it. I've already went to jail once because I believe in what I do. So, the courts don't scare me, right? I think that especially people with mental health addictions, because they're the ones who get screwed over the most in the end.
Yeah, out in the street there, yeah.
Yeah, because it's like, oh, you know what? I can give this person nothing for a whole bunch of money and they're not going to know the difference, right?
Meanwhile, they get frustrated because they haven't got what they wanted.
Yeah.
And then that causes, you know, sets of violence, all sorts of different things like that, right? And a lot of these people now are aged. Like, I'm trying to say now that, well, a lot of people of us are now older.
Speak for yourself. I still look like I'm 30.
but they're taken advantage of, right? And all that. So if they had somebody like an ethical, I believe that there should be like an ethical dealing.
Oh, definitely.
A section put out in the books if there's going to be a continued oppression against drugs, at least those that are needing a safe supply are getting a safe supply from somebody that's ethically going out there to make sure they have a safe supply, then so be it. You know what I mean? They're going to probably try and get it somewhere else and may end up not getting somebody that cares that much, right? So.
The tent, like the deal, the safe supply tent.
Where?
The Maynard Hastings action.
Oh yeah, we had what was it called?
Coalition Peers.
Yeah, I know it was Coalition Peers, but I can't remember what it was. Rock the Block or something like that. And we had a tent set up and we had our drugs testing. And right behind the tent, I set up my own little shop and I had my spoon and I was cooking and selling and cops were everywhere around and was like, are you worried? It was like, no, that means they're going to use anyways. I would much rather them know what they're using. And I got it tested. So I had this little paper that said exactly what was in there and I posted it right up. So everybody that came to buy my stuff knew exactly what they were getting. And you know, it's like, I think that if they made like a bylaw, say, okay, if you're going to sell drugs, you have to have your drugs tested. And then, because once you have your drugs tested, you know, like it'll say there's absolutely no fentanyl in there, or they'll say there's fentanyl. They can't tell you exactly how much because of hot spots, right? But at least then the person to know, okay, you know what, there is fentanyl in here. Because let's be real, some people like fentanyl. Like I can't stand heroin, but fentanyl was all good for me until I quit, right? But yeah. So, I mean, it's just a matter of knowing what you're using, because if you know there's fentanyl in it, then you won't use as much, right? So that you don't overdose. And using a safe injection site is the best, instead of sneaking home so your family doesn't find out that you're using drugs.
Yeah.
You know, because that's the biggest hype, is that people go get their dope and then run home and then nobody knows that they're using. So when somebody goes to check on them, they're already passed away. So never use alone, and you can always use more, but you can never use less. So I don't know if that's 2 minutes.
Thank you very much, Samona. I'm going to move on to Jonathan Morris. Jonathan comes back to the Canadian Mental Health Association BC division as CEO after almost 2 years in the public service working for the Ministry of Mental Health and Addictions, where he played a key role in helping build this new ministry from ground up, eventually leading the policy and legislation branch as senior director in this role. He was responsible for providing advice on a range of complex policy and legislative initiatives, while leading several transformational mental health and addictions programs. So Jonathan, I'm going to let you go now. I guess you get 10 minutes too.
Thank you so much, Kathleen, and pleasure to be here. I just, before I kick off my remarks, just want to signal deep appreciation there for the remarks from both Dave and Samona. And Kathleen is right. We need to bring the expertise and the knowledge and the ideas that you both described, whether it be about safe supply, decrim, harm reduction. I think, Dave, I heard you describe just the benefits there of how people can be more active and connected in their community, much closer to tables across the province. So I just want to say thank you deeply to Dave and Samona, and acknowledge the loss that you mentioned in your remarks there, Samona. My sincere condolences to you too. I'm going to be brief in the next few minutes and want to signal to the BC Health Coalition how important it is to see mental health, substance use, the opioid, ongoing public health emergency featuring in your AGM. It's critically important. This afternoon, I am joining you from unceded and ancestral Lekwungen speaking and Wasanic territories. And as Edith said, very important to hold that acknowledgement close as we do this work. I'm going to send around a larger deck for you. I'll upload it through the Zoom so that you can see some of the resources. I won't have time to cover all of the pieces, but what I do want to talk about for the few minutes here is just to shine a light on how the pandemic has impacted mental health and substance use. We've heard some of that up close from Dave and Samona in their remarks. And then also hopefully activate, just given the quality of organizing that the coalition does, some of your support around what we're calling upon the next government to do, now that we have clarity around who's in power with regard to mental health and substance use going forward. Very briefly, I come at this with my own lived experience. I myself have lived with pretty profound effects of depression over the years. And I too also have a family member who lives with a long-standing mental health problem in community as well. And so come at this from my own lived experience and also having spent a chunk of time in my career with the privilege and the opportunity to serve people living with both mental health and substance use problems. I just put up this slide here and I invite you to read it. These are not my words. These are Louise Bradley's words. She works at the Mental Health Commission of Canada. And there's a sentence in here that I think is so important about the pandemic that we're enduring and then tragically has claimed lives across the province and globally. And that's this idea that currently in this pandemic, protecting our bodies from harm, so making sure we don't contract this particular virus, is only half of the battle that we're facing. And there are many other battles underway, including a much more devastating set of consequences around the opioid poisoning crisis here in this province. And so I think it's just important to remember that the pandemic that we're enduring right now really does have, and I think Dave's and Samona's comments are important, very important here, that the bodies that we're protecting from harm are part of it, but our minds as well and our mental health is just as important. And so having this opportunity with your membership is critical. We've commissioned a national survey with our partners at UBC, and some of you may have heard comments I made today on the radio about this. Back earlier on in the pandemic, because whilst a lot of surveys were happening, we didn't notice many surveys really tackling key questions around housing, food security, housing security, education, employment, and the pandemic and the impact upon mental health. And one of the things that I think has happened during the pandemic is the topic of mental health is much more prominent. But we need to really address, and I think folks at this table get this loud and clear, that the pandemic has revealed clear fault lines around the inequitable impact of the pandemic on people, whether that be their income, their economic security, their physical health, or their mental health. Just a couple of key messages here. Through the early stage, and we'll be releasing the next wave of our results soon, people already living with a mental health or a substance use problem have been some of the hardest hit during this pandemic. I think across the general population, there's much more dialogue and conversation about anxiety and worry, but people with a pre-existing experience of distress or a mental health problem have been hit very, very hard. And I just show that stat just as a bit of a reference for you. The other part that I think is really important to just emphasize is everyone has been affected by a mental health. Everyone's mental health has been impacted in some way by the pandemic, but at least here in Canada, we see some striking pieces, particularly around suicide. So we actually have a massive public health problem around opioid overdoses. But losing people to suicide is also a significant public health problem that this problem faces. And we currently actually have an absence of a full-blown national or provincial strategy to address loss via suicide or by suicide. So just to draw your attention to here, through the pandemic, people who who live with a disability, who experience low income or who are racialized, have actually been at a point of experiencing much more distress to the point of suicide too. And really important to think that through when it comes to designing services, policies, resources, and care for people in distress. So with the next government coming on board, well, they are on board with the election closing, the results being clear, cabinet forming. Before the election, we worked with partners, a number of the folks around this table, to issue a pre-election platform for those running for office to consider. We've got 4 key calls that we will be planning to socialize with the province in partnership with people with lived and living experience and peers going forward with our policy team. And there's 4 areas that we really want the next government to think through, in addition to the platform commitments that they've put forward. And you can see in my previous slides a number of the key areas where people are being affected. We really are calling upon the next province to demonstrate bold leadership, particularly through the Ministry of Mental Health and Addictions. We've called for a $2 billion investment, not just in the formal system, but in community sector mental health and substance use service providers, a number of which sit at this table in your community side. To establish accountability, in 2001, the province eradicated one of the very first provincial mental health advocates to be installed in Canada, the late Dr. Nancy Hall. And arguably, we see success with the Representative for Children and Youth, the newly created Human Rights Commissioner, that there is an opportunity to install that level of accountability with a provincial mental health advocate. And we really do see a need to reinforce equity. And so recognizing that racialized folks, immigrants, refugees, newcomers, folks who experience greater contact with law enforcement, et cetera, do have heightened impacts with regard to mental health distress and well-being. And so to ensure that any investments really do land in the hands of community members who sit within key groups like Black folk, folks living with a disability, and the queer community too. Finally, and you'll see this in the materials, we've also suggested to government after consultation in and around 11 actions. I think my math is accurate here. Yep, it is. 11 actions where we really want government to think through a couple of pieces. There's some real emphasis in building upon what government has done with trying to close the gap with people who can't access counseling. And there's a few folks here who are leading some beautiful work, Melinda and Adrian, around enhancing community access to counseling and psychotherapy, low cost or free, building an evidence-based substance use and treatment system. We're really needing to make some inroads there, notwithstanding recent government investments in that area. Tackling housing, and arguably we're working with key partners to ride out a couple of important waves. Taking a close look at the Mental Health Act is something that we're calling for. And also really supporting municipalities to build momentum in building out civilian-led or alternative responses to distress and crisis in community, i.e. community-led crisis response teams, with a view to kind of strengthening that kind of response to crisis care. So I'll pause there with 30 seconds to go to say I'll upload these slides. It's fantastic to have been able to learn from Dave and Samona in their remarks. Kathleen and Edith, thank you for your co-chairing of today, and happy to respond to any questions on any of the material I've shared during the Q&A.
Okay. Thank you very much, Jonathan. These materials are going to be very useful to the BC Health Coalition and others going forward. Really useful. Thank you so much. And again, my condolences to Samona. It's very sad to hear all of this. I'm sure we can work at the policy level and advocate, because COVID is not affecting everybody equally. We're not all in the same boat. Thank you. So I wonder if there are any questions for any of the speakers. Nope.
So you can also enter if you have a question or comment in the chat box as well.
Right. Is there anything in the chat box, Usman, that relates to the speakers?
Not
What?
yet, Kathleen, but
No,
yeah,
no.
folks, if you want to put something in the chat, I'll bring that up.
Okay.
I just want to say something about COVID, especially downtown east side. I know that the white collar people are really worried about COVID, but the drug users, they're not. Like, nobody's going around being like, oh, don't cough me, you got COVID, or something. Like, you don't hear nothing about it, really, you know.
Really?
So what,
Yeah.
what are people worried about?
People are more worried about the opioid
Yeah.
overdoses, you
Yeah.
know, because that's what's hitting the downtown east side. You know, I mean, I know they say there's a lot of cases, but everybody that I've known that got COVID that uses drugs has beat it. So
And maybe say Vandy being open.
Yeah.
yeah, Vandy, we haven't changed our hours at all. We're still open. We still have our overdose prevention site open. The only thing we do is we make people do hand sanitizers and wear a mask, right? So
Yeah, these things have been okayed by the Vancouver Coastal Health, our measures, the way we're doing things with social distancing and working our way through this epidemic. They seem to be fine with it. We're doing fine. You know what I mean? We have constant cleaning of the place. People, you know, gives our members something to do, right? To keep up, keep them involved, keep them thinking that they're a positive part of this then.
Right.
Hi, may I say something here, Nadia? Hello?
Hello.
Yes.
Okay. No, it's just a comment because like 2 or 3 months ago there were a movement, like a social movement related with the decriminalization of poverty and mental health issues, and there is a kind of movement related with the fund the police and found more, for example, mental health services. So, what is the position of this coalition about that?
Well,
So good.
so
Good.
what is the position of the
Yeah.
coalition around these things? I would think we haven't really focused as much as we should and we will on these issues. We have study groups who look into the issues in depth and we get moving quite quickly. And we do a lot of advocacy directly with the government to get the needed changes.
And maybe I'll just add to that, Kathleen. Thank you, Nadia. I think we've focused primarily on improving services. So we know that calls to defund the police, I think, are super valid, and often part of that call is to improve the community services that are available to address the social determinants of health, so housing, poverty, and certainly those. I think as a coalition, we've focused more on working with government and the Ministry of Health and other providers to improve and expand the services that take care of people, that really address health issues, instead of police officers being called. And so, but I think your comments are well noted. They're very timely, and I think it's, as the coalition, we want to be like actively part of these conversations. I saw Ed's hand as well a couple of minutes ago.
Yeah, I can't see anybody's hand.
I know it's a bit tricky, so maybe if we're not finding you on the screen, please indicate in the chat box as well. Ed, do you want to go ahead?
Yeah, if I could, please. I just wanted to point out that if you haven't seen in the chat box, Lead Now, I just received this morning a petition, an online petition, asking people to sign to encourage Premier Horgan to decriminalize the use, sorry about that, to decriminalize the use of opioids and drug use. So please sign that petition. This is really important, an important initiative, and I think that we're on board.
Thank you. Okay. I'm just wondering if anybody else has anything else, comments, as well as questions they would like to make. If not, we might be able to move on to the next section, but
Hello.
hello.
Hi, it's David.
Hi, Dave. Go
I just
ahead.
had one more thing I really thought that's important is that we have to encourage the powers that be that are dealing with people in situations where there may be a mental health situation is to come in and not to inflame the situation. They have to be taught how to come in and accelerate these things. Like, I can't remember if that's the right word I'm using, but they need to be taught how to come in soft and quiet and helpful, not in an accusatory or intimidating kind of way, right? Because these people are already in a very fragile state. So dealing with them, it behooves all the people that are involved at that stage and level to be either trained or at least aware of and able to do the task that they're supposed to do the proper way.
Or get somebody with lived experience to go in first or
yes, have lived experience people with them to help them understand how to deal with that situation a little better, maybe.
Right, good point. We have a lot to learn here. I'm looking at the chat room. I see somebody's asking a question about reopening the Riverview facility. I wondered if, Dave, if you had any knowledge of that. You remember Riverview?
I've heard of Riverview. No, of course. I've been out there. Actually, I used to work in film, and we used to, in the parts that they closed down, we used it for filming a lot of different things out there.
Yes, they do.
But very scary place, actually. I feel that people were dealt with in a very bad manner out there, probably at some time. Okay. But besides that, yeah, I have heard that there's been thoughts of that, and all I can say is please make sure that people aren't treated the way they were there before. You know what I mean? There definitely has to be an upscaling of actually everything out there then, if that was going to be the case.
Well, I don't think so. I think it's just a glorified jail. Like, they throw them in and feed them drugs that they don't want. Like, instead of them saying, okay, you can have some crack or you can have some crystal meth. Oh no, I'm going to give you some pills. Like, I don't want to take a pill to get high. I wouldn't want to be shoved in some place and said, here, take these pills because they'll make you feel better. Like, no, I'm sorry. Like,
right. Yeah, I'm asking that because I believe there was somebody in the government, one of the MLAs, who suggested something about.
That's just so they can get us all in one place and they don't have to see us.
Yeah, and I think Simona's comment is.
Yeah, do you want to comment?
Well, I think there have been those calls, and CMHA has clearly said, reopening Riverview and moving back to institutionalized care is not the answer. It's really? I think Simona's comment is clear. Often that's driven by a desire to remove distress from community and put it out of sight. I think that was what I just heard her say very, very clearly, and really, going down that track without fully imagining what community-based support looks like. That's the problem. We just haven't fully realized what community-based mental health and substance use care looks like in this province. And so recognizing that there are folks who need higher levels of support and intervention, going back down the track of reinstitutionalization is something that would be something that the BC
could I say something?
Go ahead.
Yes.
Could you identify yourself?
My name is Michelle Baudry, and I'm a retired psychologist. And at the time when they were, just before they were closing Riverview, I had a number of clients that would themselves wish to go into Riverview, and they were very well taken care of. It was in West Lawn, and there was also a group there of various patients who chose to write a paper. They contributed to the Port Coquitlam paper, and they were really keen on having a little community with various cottages and that sort of thing, so that people could either live independently or have the services that were provided there. So I disagree with most of what you've just been saying. I think that a lot of the people felt that they were well cared for, and they actually chose to go there to be serviced by people who really knew what they were doing.
Right. All right. So I'm looking at Nancy Clark to everyone. Are you there, Nancy? Nancy Clark has
sorry,
something
yeah.
in the chat room.
Yeah, I've just unmuted. Sorry about that. Yeah, this is a very, very interesting discussion. I've worked in the downtown east side most of my career. I've retired from there and now I'm an academic in another world trying to shift policy and practice. And I think what's been said is really well stated, and it's not surprised that that some community members want to reside in a setting where they have access to food security and shelter and those kinds of things. And I just want to make a comment that for many, many years, we were trying to work with the police with providing education and with CAR 87 in our crisis response. And that's still going on. And I think that Surrey has increased their hours for this with the RCMP. I'm not quite sure because I'm not involved anymore, but the training isn't, as far as I recall, not mandatory and it's not systemic. And I think through, with the police. So I could be wrong on that, but at that time, it was only a few. And I think the hours should be expanded, not just after our crisis, but 24/7, where we have a nurse or someone with lived experience. Again, you don't want too many people because that can be traumatic in and of itself. But so I just want to say briefly that I've experienced my clients being tasered, being shot, incredibly distressing. I have gone to court over this. So this was my experience as a work, as a street nurse in the downtown east side for a decade. So not all cops are bad. Some are awesome, but it is a big issue, and I think we need to really collaborate. That's all. Thanks.
Thank you. Thank you. There are for sure huge systemic issues that we have to deal with. Yeah.
Kathleen, I just saw AJ was hoping to make a comment.
I can't see everything, but
that's
go
okay.
ahead,
And go ahead.
I'm trying to figure out how to say this. I think I'm just going to pass for now. Thanks.
Okay.
No problem.
When you're ready, we have a few more minutes, I believe. Is that right, Jusman?
Yeah, we have about 7 more minutes. So
yeah. So.
Okay, I'll go ahead.
Okay,
I think it's pretty well known that Canada is very much lacking, BC included, in accessible mental health care. And I'm sure that a lot of us would have anecdotal evidence to support that there is good care going on here or there. That's for sure. Like, you can't paint anyone in any profession with one brush, but I think it's safe to assume that we're sorely, sorely lacking in mental health access. And that would be kind of across the board in my experience and in my opinion. So I think just keeping it open to that despite, one or two of us may have had good experiences or heard of people who had good experiences or review or what sort, but it is anecdotal, and the bulk of the evidence really does point to quite a lot needing to be done in terms of how people access mental health care, especially mental health care for people who are severely impacted by mental health issues. There aren't good options in Canada or BC, and it's a crying shame. There are people out there doing good work for sure, but I think the point is for that to be more of the norm than the exception.
Right.
At least that's my point.
No, certainly. And I think, some people have access to some limited extended health benefits that might include counseling or psychology, but I agree. I think it's a huge gap. It's people just can't afford to access a lot of mental health support. I see Leslie, and then maybe that will be our last comment, just so we can start transitioning. I see Asan as well. So Leslie and Asan, if you can keep your comments fairly brief, and then we'll wrap up.
I just want to share 2 points. One is mental health care has been in a completely separate silo from normal family health care. And in Langley, they've got a project that they've been embedding some mental health professionals in the practice clinics. And that's been very helpful, because it's been hard for the doctors to provide proper care to their patients if they don't know what the mental health diagnosis is, or it was completely unbelievable. The second thing is that the way the way some of the persons with mental illnesses, mental health issues are being housed is causing a lot of problems with seniors. And this is not just in BC, but across the country. So, I mean, it's very hard when there's just such limited social housing that incompatible populations are being housed together and actually causing health problems for other groups. So we have to really figure out a much better way, and it's just tragic to hear the lack of support in BC for this type of work. I have a sister-in-law in Edmonton who seems to get a lot better support for her mental health concerns. Thank you.
Right. Thank you, Leslie. We have a lot more information on the point that Leslie's making if anybody wants to follow up.
Yeah, I've got a report I could share with anyone who wishes.
Right.
That was put together in Langley.
So Ishan?
I just have a point there. I've been on those committees for a quite long time, and I have been hearing all these systemic problems, you know. But there is any cure side of it? Any percentage we got good, or we are keep on going highlighting the problem? Because nobody talks about the positive side of it, how many got good, how many got cured. Nobody tells you that. So is there any success in those programs, or we just keep on going, kept the funding from the government and keep on going like that?
Okay, well, sounds like John could answer that. Jonathan?
Isan, and hopefully I'm saying your name correctly. I mean, I would say to AJ's commentary, well, there's two sides to the story. I'll just take 30 seconds. I think we've had a mental health system and a substance use system that's been on a deferred maintenance plan for decades. So it's like you've got your 1970s car and you haven't changed the oil for 30 years. And so now we're trying to catch up with that deferred maintenance, and there's a road to go there. We before COVID hit, we have a mental health system where, as has been commented here, often the front door to that mental health system is the emergency department or contact with the police officer, because we don't have those things. So that there is a need, there's a crying need for change. And I think many in office and at this table recognize that need, and this kind of conversation is so important. The other side of your question is that there absolutely are successes. So you've got Melinda Markey on the call today, who leads the Community Action Initiative. And you could sit with someone like Melinda for some time and hear about how community change is happening, including in the area of community counseling. I referenced that the province actually made one of the biggest investments in its last term in community counseling. And we monitor alongside CAI just the number of people, like thousands of sessions of counseling that people would not have ordinarily been able to access before that investment. And so there are things that are working. There are programs that we're funded to do that we hear non-anecdotally, but from the data we see that have literally saved lives. And I'm sure within the opioid or substance use harm reduction space, there's other good examples where good interventions have also saved lives. But just listening in on this conversation for Edith and Kathleen and Usman and Audrey and the team, I think there's a beginning of such an important conversation here that I know many of us would want to contribute to and support going forward, because you represent such a strong coalition. And I'm personally, on behalf of the organization, very glad that you're starting to index mental health and substance use as part of your work going forward. I hope I partially addressed your question.
Yes.
Thank you.
Was that the question, did that address your question?
Yeah, I got it. It's a slow process. He said we get some successes somewhere. Yeah.
Yes, we do.
And Kathleen, if I could just reiterate, you mentioned in the beginning of your introduction to this really wonderful panel and discussion. So after the AGM process, the Health Coalition will meet with the new steering committee and staff, and be working towards a strategic planning session as soon as possible to talk about the priorities for our work, our annual work plan, and also looking ahead. And I think you know, it's clear to me, like from this discussion and also individuals and organizations that have raised this in the past, that mental health and substance use are critical public health issues. And I'm looking forward to figuring out how we can be more involved.
Okay, thank you. So Usman, can we move on to the next part of our agenda?
Sure.
Have we covered everybody in the chat room that wanted to speak?
Yeah, I think we've covered everyone in the chat room. So
Okay.
before we move on, I just wanted to thank our speakers, Dave, Samona, Johnny, for joining us. And yeah, so thank you so much.
Yeah, we're all very, very grateful. And this gives us a really good start, motivates us to work even harder.
Thank you,
Yeah,
everyone.
thank
Take
you.
care.
Thank you. We'll see you again.
Thank you.
All right. So now we're going to call the AGM to order. And we need, first of all, to have an approval of the agenda. I don't know if anybody has looked at the document, but can we have somebody voting to, okay, can somebody move a motion? Is that how you're going to do it, to approve the agenda?
I move the agenda.
Okay, that's good. And is somebody seconding it?
I'll second Agnes Jackman.
Thank you, Agnes. So anybody objecting to the agenda? And if not, that's the agenda approved. Now we have the minutes from 2019, not 2020, of the last AGM, I believe. If anybody has had the opportunity to read it and find something that they don't understand or would like to ask about, please let us know. I can see Agnes reading away. So if nobody has anything to add or subtract, perhaps we can have a motion to approve the minutes of the last AGM. Agnes, thank you. Seconded?
I second it.
Oh, great. Thanks, Isan. All right. Any other comments? If not, we're going to conclude that the minutes are approved and move on to the next thing, where I get to say a few words. Are we on time, or where are we at with our time, Usman?
Yeah, so we've called to order. We've approved our agenda and minutes. So we'll do a short presentation of our annual report, which was sent out earlier. And then we'll also present our finance report. And then after that, we'll do a short break before we come back for our caucusing process.
Okay.
We're doing good on time, though.
Okay, that's what I wanted to know. Thank you so much. All right. On the AGM report, it's quite long, I see, and very detailed. Thank you, Isman and staff. I hope we'll have, I hope everybody will have time later on to read the full annual report if they haven't. But in the meantime, I want to just mention a few of the issues that we've been working on. First of all, the Cambie case. BC Health Coalition and its lawyers, together with Canadian Doctors for Medicare, have been actively involved in the Cambie or Dr. D court case to ensure that we do not have a two-tier healthcare system, one for the rich and one for the rest. After extensive testimony over 4 years in the BC Supreme Court, the judge decided against Dr. Brian Day and the Cambie private clinics. However, Dr. Day has appealed the decision, and the appeal is going to be heard in mid-2021. BC Health Coalition will continue working with its lawyers on the case, and that has been a lot of very hard and detailed work on the part of coalition staff and members of the steering committee. We have 3 working groups or subcommittees that study and recommend action on BC healthcare priorities. these are the Anti-Privatization Working Group, which has taken the lead on the Canby case, the Community Clinics and Primary Care Working Group, the Seniors Care Working Group. And because that's one that I'm involved in, I want to say a little bit about that. And I have the permission to do that. I would be brief, but I want to say that from time to time, there might be an issue where we might have a task force. For example, with the election, we set up an election task force and very quickly put together issues papers, and Ed Sharples was very good at coordinating that. Ed, do I have your surname correct? So what I want to say is, as I'm the co-chair of the Seniors Working Group of the BC Health Coalition. A priority of the group has been seniors care and getting some policy change on long-term care in particular. The BC Seniors Advocate, whom some of you know, has been documented the abysmal state of care in BC, in long-term care in BC, since she was appointed in 2014. She has provided several reports. But until COVID-19 publicly exposed the inhumane conditions that some of the residents and frontline workers experience, and what they have endured, nothing much has changed. However, this year with COVID, and after the famous Army reports in May of this year, Ontario, for example, has had a commission of inquiry. At that inquiry, the Ontario Nurses Association noted that in the previous 10 years, there had been 50 reports on problems in long-term care, but nothing much had changed. The same thing has happened in this province. Together with other experts and advocates, they see this as a combination of deeply rooted ageism and sexism. The residents are mostly women in long-term care, about 2/3. The care rates, 80% or more, are mostly women, often racialized women. We know that most seniors would prefer to live at home as long as possible and not to be institutionalized. But assistance for seniors with low incomes, and there are many in BC, with home support and home care are very hard to qualify for. Those who can pay for the assistance they need to remain independent do so. So COVID is not hitting everybody equally. Some are really struggling, but nobody really wants to go into long-term care right now, where 80% or more of the deaths from COVID are occurring in Canada now. I'd just like to say that long-term care has been very underfunded for a long time across Canada. Canada currently spends much less than any OECD, maybe up to 1/3 less for some OECD countries on seniors care. So that has to change, but why it hasn't changed is something that we're all grappling with. But seniors would really prefer to stay at home, particularly during COVID. So that's all I have to say. I think if anybody has any questions, we can direct you to where you might want to look to get further information, for example, from the Seniors Advocate. Or we have lots. We've been involved in signing on and providing webinars, and I know that BC Health Coalition is going to do 2 webinars on seniors care very soon. But we've signed countless petitions. We've submitted them to the federal government as well as the BC government. We're not getting a lot of traction. BC government has made some moves, as has the Ontario government. But we understood from the throne speech that the federal government was going to work on standards in long-term care and would really have a national program. But for some reason, in the past 2 or 3 weeks, Prime Minister Trudeau seems to have backtracked on that. So we need to find a way to continue to push very hard. So that I've had my say now. Thank you very much, everybody. And I think we can move on to the next session with Edith, the next report.
That's great. Thank you so much, Kathleen, for highlighting and for making those remarks on the critical situation with long-term care and for seniors across this country. That remains like an urgent priority of the Health Coalition. And maybe I'll just encourage everyone on the call to spend a minute just taking a look at our annual report. These working groups have worked super hard in the past year, and just really want to thank and acknowledge the co-chairs and everyone who has participated. If you are yourself interested in getting a bit more involved on our seniors working group or primary care reform working group, please get in touch with staff, so Usman or Ishani or Audrey, about how to do so, and they'd be happy to give you a bit more information about meetings. We really welcome a variety of voices at the table. And thanks again to staff for such a nice looking annual report. So I am going to just briefly talk about our financial statement. And Usman's just mentioning it was all Ashani, the beautiful, the beautiful annual report. Thank you. So if I think Usman's about to share a screen. So we did share our financial statements. This is from 2019. As we are still in the fiscal year of 2020. And so it was a while back, but I'm happy to just take a look at this document with all of you. So you can see our total assets, our liabilities, including the legal defense project, and taking a look at both of our revenues. So that's 400,000, 55, 238. And then total expenses come in at 435, 236. And in the year 2019, I just want to note, so there was a surplus of $20,000, and that was because we had planned to do an in-person conference. And so we had fundraised and also set aside sort of approximately that amount to support people traveling in from outside of the Lower Mainland, rental space, and food costs. And so because of a number of reasons, including a bit of staff turnover, we weren't able to, we weren't able to host that conference in the fall of 2019. We certainly had plans to do it in 2020. And again, there were some staffing changeovers, and then of course COVID hit. And so we did have plans to have it, first in the spring, and then of course they were postponed until the fall. And then unfortunately, we just felt that an in-person conference was just not an option at this time. So that's what that surplus was about. I have sat as well as several other members of the steering committee on the finance committee, and I think we can, easily say that we are on track with our budget. There haven't been major surprises. We've been able to save quite an amount of money because we're not able to hold events. So I welcome any questions about the financial statements. I can't actually see the whole delegation, so if there are questions, please, can you please type them into the chat box?
The federal government doesn't give you any grant at all?
No, so we don't get it. So the federal government grant, actually, that I think is a line item, because in the past we've had we've done the summer student grant program, where the federal government provides grants to support paying a student to work with your organization in the summer. But that's not something that we've done in the last couple of summers. And AGA, I see that question about the surplus. So yes, as we were planning out the 2020 budget, that surplus went, I think it was split between both going into the reserves and into the rolled over into the 2020 operating costs. Yes, so there was a question about the legal defense fund. Yes, so legal defense fund is totally separate from our operating budget, and so that we fundraised in separate ways for that legal defense fund, both with provincial and national partners, and certainly all of that money is used for the legal costs associated with our participation in the Canby case. And so we have been able to pay all of the legal bills for the BC Supreme Court level that is just finished. And then we're looking ahead to fundraising for the appeals process in the next year.
Have you money left over from previous funding?
For the legal defense fund?
Yes.
Yes. So I think there's just under $100,000 in the legal defense fund, which is good. That's a significant amount, and we are just in the process of working with the legal team to figure out costs for the next level of court, as well as the Supreme Court of Canada level. So we'll certainly be keeping that precious money in the legal defense fund, and it will certainly be used.
That's a good idea. That's good.
AJ was just wondering about what are the BC Health Coalition's current reserves. I'm sorry, Esme, I don't have a current statement of our budget. Our budget right now.
I'd have to look that up. So if you give me a second.
Sure. And then Leslie is just asking in the chat, will the Canadian Health Coalition be involved when Canby case is heard at the Supreme Court level? That's a really good question, Leslie. My understanding is that at the Supreme Court of Canada level, groups are able to apply for intervener status. So we don't have any control over that. So I think we worked closely with them throughout the BC level of court in terms of them supporting to get the message out and coordinating on media, etc. And so I imagine that we'll remain in close contact about our individual separate involvements in the case. And I'm not quite sure if they would choose to apply to be interveners, but they may well. Great. Okay, any further questions about the 2019 financial statements?
Edith, just to go back to AJ's question, as of the end of August of this year, our total retained earnings were close to $52,000.
Great. Thank you for confirming that. And I believe, so just for everyone to understand, so reserved earnings, so that organizations have to have or are supposed to have a percentage of earnings required in case the organization had to close up. So, had to dissolve. And so they're to be able to pay out staff, wrap up any lease requirements, that kind of thing. And so we, in the passing of the 2020 budget, definitely put a significant amount of that surplus into the reserved earnings to get increase that amount. And so I think for nonprofit wise, I think that we have a pretty healthy amount in our reserves right now.
Can I just follow up on that?
Yeah, please.
I know there's an actual legal requirement for what we're meant to have in terms of those closing up in case of emergency. I was really railing on this our last AGM, or maybe it was an AGM/victory party for, anyhow, I was, and then COVID happened and everybody's like, whoa. So I really do want, I do want us to, because we're all financially responsible for this organization, right? So I really would like to, move in the direction of making sure that that's a solid goal of ours. I don't believe that we're at the place where we're meant to legally be in case the organization would need to shut down. So I'd just like to revisit that and get more of a solid plan in place, given how uncertain things have become for the entire world in this past year. So where are we in terms of where we need to be? those for reserves wise?
AJ, I don't know the answer to that. That would be a conversation that I'd have to have with our bookkeeper, Marianne. But I'm certainly happy to find that information and carry on that conversation with her and to loop you in.
That would be great. Yeah, I just would like to make sure that we're on a trajectory to meeting that legal requirement. Even if we are doing better than most NGOs, I've been through the scary aspect of having no reserves and an org almost folding, and it's not nice.
No, absolutely, and I really appreciate your comments and your efforts to steer in this direction, because I'm in full support, and I think one of the first orders of business once we have our new secretary treasurer and the confirmation of our steering committee is to have a finance meeting and to make sure that's on the agenda.
Okay, that sounds great. Thanks so much.
Are there any other questions about the 2019 financial statements? Okay, hearing none. Can I have a motion to accept the financial statements?
I move the statement should be accepted as presented with any addition, whatever we discussed with that.
Thank you, Asan. And can I have a seconder?
Yeah, I'll second.
Thanks, Sheila. I can't remember if I'm supposed to say all those in favor now.
Just say yay, it's done.
We've moved it. We've moved it. Move along.
All right. We have to approve it after the motion. Isn't like move, second, and then yays and nays? Isn't that how it goes?
Yeah.
Sure. All those in favor to approve the moving of this motion. I'm sorry, I think I bungled that. Okay, thank you all. So consider the 2019 financial statements in stone. They are entered. All right, so we are going to start to transition into the caucus process. So this concludes our sort of formal part of the AGM that's open to the public, that's open to all members. So thank you so much. We really appreciate all the individual members who joined us. As I mentioned before, please get in touch with the BC Health Coalition staff. So that's Usman or Ashani or Audrey in the chat box. If you forget their names, if you would like to get more involved in the working groups or find other ways to participate. We are just another plug for, there's a really great seniors care webinar happening. You can find the details. Maybe we can post that in the chat box, the details for the Seniors Care webinar series that is launching, which is a wonderful partnership between Council of Canadians and the Health Coalition. And I know some of others of you on the call have been really helpful in setting that up. We're going to, I think we should take a 5-minute, like a stretch break. So let's come back at maybe let's take 10 minutes, 5 minutes.
Okay, sounds good.
Yeah. Let's take 10 minutes and come back at, let's see, 1:35, and then we can start into our labor and community caucuses. So again, if you're an individual member, we wish you well, stay safe. And then if you're an organizational member, either of the community or labor caucus, then please come back at 1:35 and we will make sure you're in the right group. Okay. Thanks everyone. Thanks so much. See you in 10 minutes.